7,8-dehydroxyflavone, or 7,8-DHF, is a natural type of flavonoid that's found in some plants in the genus Sephora. It has a variety of reported uses, including as an antioxidant, an anxiety reducer, and a sleep aid. 7,8-DHF is the most common and effective flavone that's identified in Sephora plants. Aside from its use as an anti-inflammatory agent, it's also able to induce the expression of MMP9, a zinc-dependent endopeptidase that's involved in the extracellular matrix degradation, and consequently it increases the bioavailability of HMGB1, a nuclear inflammatory factor. It's used by parasites and macrophages to generate free radicals that serve as signals for the macrophages to engulf the necrotic or the dead cells and pathogens. It's also involved in the modulation of angiogenesis and tissue regeneration, and in that sense it's considered to be an anti-cancer agent. It's also reported to have anti-stress effects, and it's being studied for treating anxiety, depression and insomnia, alongside commonly prescribed treatments like SSRIs. 7,8-DHF activates a receptor called orphan G protein coupled receptor gamma, and this is located on macrophages, and this leads to increased production of intracellular reactive oxygen species, thereby amplifying the intracellular inflammatory reactions. 7,8-DHF also leads to downregulation of PGC1-alpha. This is a protein that's involved in regulating glucose and fat metabolism and promotes insulin sensitivity. Suppression of PGC1-alpha leads to lipid accumulation in white adipose tissue. This results in an increased expression of leptin receptors, which are responsible for the high calorie burning activity of 7,8-DHF. In this way, it effectively induces weight loss by increasing thermogenesis. 7,8-DHF also enhances the apoptotic effects of caspase-3, and this promotes the cell cycle arrest, and it manifests as a form of death known as apoptosis. The 7,8-DHF reduces the reactive oxygen species in the macrophages, and this leads to an increase in the expression of pro-apoptotic proteins like caspase-3, BAX, and P21. As such, the 7,8-DHF controls the cell growth and the other properties that regulate the cell life cycles by promoting the cell death. 7,8-DHF is available in both capsule and powder form. The recommended dose is between 15 mg and 300 mg per day, depending on its application. As with any other drug, 7,8-DHF isn't without side effects. However, there's not as many side effects associated with 7-DHF as it's a natural product. Some of the reported side effects are an increased heart rate, but this can be remedied by reducing your dose of 7,8-DHF. Gastrointestinal problems, but this can be resolved by taking the medication with food. Abdominal pains, but this can be remedied with increased hydration. It should not be used by people with a history of epilepsy. Higher doses have also been noted to lower blood pressure and cause headaches. It was reported by some users that they experienced a reduction in their acne after taking the supplement. 7,8-DHF is a relatively new supplement, and it's been in the news for its positive effects on various age-related conditions like cognitive decline, weight loss, anxiety, and mood disorders. The ability of the 7,8-DHF to act as an antioxidant and promote neurogenesis makes it a potential treatment for neurodegenerative diseases like Parkinson's and Alzheimer's disease. Clinical trials have also shown using 7,8-DHF results in weight loss as well as reduced blood pressure. It's also been linked to improvements in mood disorders. Many find to prevent a tolerance and to enhance the benefits of 7,8-DHF, it should be taken with polygala as they work synergistically together. To learn more about 7,8-DHF, check out the link to my other video in the description. To learn about polygala, herbs, supplements, natural treatments, or to book a consultation, check out my website.